Biologic drugs are going to be more and more important to us in oncology and haematology. Biologic drugs are what we call targeted therapy. They're made in living cells, they're quite complex macromolecules, but what they do for us is they give us more effect and less toxicity. The lock and key drug. By analysing a tumour not perhaps at its simple microscope level, but its genotype, we could select drugs that will enable us to control advanced cancers. And already we have examples of diseases where we can more than triple survival in incurable cancer through this approach. If you look at the University College London statements that helped to set up their big new Cancer Genome Centre and to give some legitimacy to the British Cancer Genome Project, it's a belief that by 2050 we might eliminate cancer deaths in the under 80s. That's remarkable. Cancer is the world's biggest killer. It has been so for the last 6 or 7 years. It's bigger than malaria, TB and HIV combined 3 times over. We have an affordable medicines programme for the world to provide medicines for HIV, malaria and TB to reach at least 80% of the population at a price that's either free or affordable. And we now need to do that for cancer. And so the bedrock is precision targeted therapy, biologic medicines. We need biosimilars for all the reasons about why we need biologic medicines. If we're to need 3 concurrent therapies to turn an advanced cancer into a manageable chronic illness, we have to be aware of the cost. And since 2015, we haven't seen a new cancer medicine that has been sold for less than $10,000 a month. And the point about turning advanced cancer into a chronic disease is it may take a lifetime of therapy, as it does, for example, for rheumatoid disease. And if you're spending $10,000 a month for a drug and you need 3, that's $30,000 a month over a year, we're talking about $250,000. And you realise why, even in the most wealthy countries, this is not going to be affordable with our current platform of medicines at the price they are. So why we need biosimilars is very simple. It's economic. We want drugs that are similar in action, how they work in a patient, but dissimilar in price. And the reason we need it now is that already we know we've reached the ceiling for affordable care in the wealthiest countries.